Another deadline missed as the president's health care plan is now stalled in Congress. Joining me now, a supporter of the president's plan, Congresswoman Debbie Wasserman Schultz, and it is great to have you with us.
Great to be with you.
Obviously, conflict and contention in the House of Representatives, an outright statement that ends any prospect of meeting a deadline in the Senate. How much trouble is the president's health care plan in?
Well, I don't think it's in any trouble at all. This is a really significant reform. We're trying to reform the health insurance industry and make sure that we can cover everyone in America. And, you know, we're really being careful about the details and making sure that when you lose your job or if you change jobs, you can make sure that you don't lose your health insurance. We're trying to make sure that you have comprehensive health care coverage, that you don't have to worry about being dropped for a pre-existing condition or excluded for a pre-existing condition. We need to inject some stability and security into the health care system.
May I?
That's going to take us.
I got the talking points, but here's where we are.
They're not talking points, Lou. The reality is that Americans need health care.
May I?
You absolutely may.
Thank you. The polls show a complete, right now, reversal of fortunes, if you will, for health care as proffered by the president. How is it that the House and the Senate can overcome what is clearly opposition now in the public to the president's handling of health care?
Well, Lou, I reject your premise that there's been an outright reversal. There has been some slippage in the polling where it is not, you know, in the 60s or 70s that people support the specific legislation that they think we're considering, but the majority of Americans, it is still over 50%, that support making sure that we can reform health care insurance, that we can make sure that everyone in America is covered, that we can make sure that small business owners can continue to provide health insurance or provide it for their employees if they can't now. Those are real issues, and real issues that affect our economy. And the only way, as President Obama said last night, that we're going to really get our economy back on track, please let me finish now, Lou, is if we make sure we reform health care insurance so that we can get the economy back on track and stop the bleeding, because we won't be able to fix the deficit without making sure that we can fix health care insurance.
How will you pay for it?
We're in the process of putting together legislation that will make sure that we can, through cost savings and belt tightening, will wring a lot of the excess waste that is in the health insurance system right now.
I've got a hard out here. I thank you very much.
Thank you for having me.
Thank you very much. We'll be right back.